Welcome back to Healthy Living. I'm your host, Melissa Hodgson, and we're talking today about robotic surgery. We spoke first with Sunil Pruitt, local urologist, who talked about the start of the Robotics Institute at St. Tammany Parish Hospital and how robotics has changed urology. Next, we'll speak with Dr. Patricia Braly, women's cancer specialist, whose practice is in Covington. She'll talk with us about how robotic surgery adds to her practice and what it can do for patients. Dr. Braly, thank you for joining us.
It's my pleasure, Melissa.
Really excited to have you here.
Thank you.
So you've been in practice in OBGYN and in women's cancer for decades.
Literally, yes.
Tell us
35 years.
35 years.
Yes.
And how many years were you in practice before you began to do robotic surgery?
Well, let's see. So I think I started shortly after Dr. Pruitt, maybe within the year.
7, 8, yep.
Yeah, and so over 25 years without, and I was one who trained before laparoscopy was as available and advanced as it is now. So I really went through my training and my early years of taking care of patients without doing much minimally invasive surgery. I really didn't like doing it. I came up with all kinds of excuses, you could say, about why we needed to do major surgeries with laparotomies. And yes.
Your training was that open surgery, and you
Yes.
felt the safest thing for your patient was that open surgery?
Yes.
And laparoscopy, of course, is minimally invasive,
Right.
but without the robot, it does not have the same kind of visualization.
It doesn't have the same kind of visualization. It also doesn't have the same access as far as angles of the instruments, as far as, you know, going around tissue or tumors or opening up the retroperitoneal space and looking for lymph nodes and things like that. Much harder with what we call straight stick laparoscopy.
So what you found from your training in open and then the introduction of laparoscopy and then the introduction of robotics, radical change there.
Very, very, very big change. And so I would say one of the real advantages of having the robot is it's allowed both surgeons and procedures that used to be done almost always open now to be done with minimally invasive surgery.
That's exciting.
Yes.
So specifically in OBGYN surgery and in your case in women's cancer surgeries, can you talk a little bit about the kinds of procedures that women may have had to have open in the past that weren't laparoscopic candidates, but because of the precision that you have with the robot, that changes the game and enables surgeons like you to do those?
Yes. So the robot is being used extensively for both, for hysterectomies, both for benign indications and for cancer. For benign hysterectomies, one of the places that the robot has made it possible to do minimally invasive surgery instead of open is like with fibroids, big uteruses that potentially would be very difficult to do with laparoscopy or vaginal hysterectomy. So the robot's allowed for increasing the number of patients having hysterectomy for benign indications to have it done with minimally invasively. Another area in benign GYN is endometriosis. Endometriosis causes horrible scarring, and even with a big incision, it is very difficult to see maybe where the colon sticks to the back of the uterus or where the ovary is sticking to bowel or different structures. And the robot, because of the optics, we have high definition, magnified 3D vision with the robot, as opposed to with laparoscopy, we're looking at a TV screen.
Right.
And so that's obviously two-dimension, very, it's high acuity, but the 3 dimensions and magnification and being able to have the camera this far from where we're operating is very helpful. We also then use it for cancer, and one of the places where it has been, the robot has been particularly useful is in patients that are obese, because obesity is associated with endometrial cancer. And so we have lots of patients, many of them quite elderly, that are very obese, and doing a big open surgery, cutting through maybe this much fat in their abdominal wall makes it very difficult to get to the uterus and to remove it safely. And so the robot has allowed us to operate very safely and quickly and with minimal side effects or complications, even in elderly, very obese patients. We also, it really facilitates our ability to see lymph node, the area where the lymph nodes are. And one of the advances that is now available is we can actually inject a dye into the cervix, and then we can see the lymph nodes. It's called sentinel lymph node dissection. We can identify the first lymph nodes that the cancer would potentially spread to, and then there's a fluorescence technique with using the robot. So we can turn it on and off, and we can see things normally, and then we can switch it and we can see these glowing green lymph nodes that we can remove. Wow. It's very impressive, yes.
Well, that sounds like an exciting advance even beyond robotics, that you have more technology that has been layered on.
Yes, yes.
What do you see in women's cancer and in OBGYN coming on the horizon?
Well, I was going to say we're going to be doing more of the sentinel lymph node dissections. A lot of times when we feel like we need to remove lymph nodes to make sure the cancer hasn't spread, the patient does not have any metastases in the lymph nodes, but we've put them through that additional procedure with the risks. The lymph nodes tend to be right next to big blood vessels, and sometimes patients get swelling, like in patients who've had breast cancer and had lymph nodes removed under their arm, have to worry about swelling. Lymphedema. We have that same issue sometimes when we do pelvic lymph node dissections. So I would say, as far as near future, it would be more use of the fluorescent feature of the robot to identify sentinel lymph nodes and minimize the number of lymph nodes we have to remove.
To be able to see that.
Yes.
And as you were saying, part of the way you're able to see that is the robotic system has a camera and the implements in the
Yes.
patient, and the surgeon is at the console controlling all of that,
Yes.
and your vision is magnified and three-dimensional.
Right. Right. I tell my patients it's a little bit like the movie Honey, I Shrunk the Kids, where I feel like I'm a little person right there working on the patient. It's pretty amazing.
Like Miss Frizzle and the Magic School Bus.
Exactly.
Very good. Well, I appreciate your coming out today to talk with us about robotics and specifically what that means for women's cancer.
It's my pleasure.
Excited to have you at St. Tammany Parish Hospital helping us deliver world-class robotics close to home.
Thank you. Thank you. It's my pleasure.
Thank you so much. We'll be right back on Healthy Living with our third guest, Dr. Jacob Daigle, to talk about general surgery and how Da Vinci robotics makes a difference in that area of specialty.